The unknown toxicity of medicine. Hi, this is Laura Lee, and this is part 3 of the unknown toxicity of medicine. I will just go ahead and continue. This is written by a medical doctor that tried to get help in her medical world, and nothing would help her sickness. So she went over to the natural world and found tremendous difference in contrast in results. And the experience of it is much more fun than the torture that goes on with chemotherapy. So that's what we're talking about. Explain in the next video the chemotherapy, how it works. And this is, go ahead, part 3 is first come the antibiotics to kill the infections that you'll get from your immune system being destroyed. Then, when all the natural bacterial flora in your intestines are killed by antibiotics and the chemotherapy, the Candida yeast will grow out of control in your body. This will keep wanting to draw your blood and culture it. They will keep on wanting to draw your blood and culture it. The cultures will test positive for various yeast and fungi. Then they'll give the highly potent and toxic antifungal drugs, the worst of which is amphotericin B, which, if you survive it, will likely put you into kidney failure. Then the viruses will grow in your blood. By now, you have no immune system. And they'll add the antiviral medications, on one of which is made from bat poop. Pretty soon, the medication list will become so long that the nurses will make mistakes trying to remember all the drugs and doses you're supposed to take. Then you'll have a horrible reaction because you took too much or not enough of the right drug, or the doctor made a mistake and mixed drugs and he shouldn't have mixed. Now you're covered with a horrible rash and you can't breathe because you've had a severe drug reaction. You'll be on oxygen, panic-stricken, because all of the adrenaline they gave you to control the reaction, and the doctor will tell you that you're suffering from complications. There are always complications, aren't there? If you survive all of that, the doctors will want to repeat another bone marrow biopsy to determine why your red blood cells are not growing back after they kill them with the chemotherapy. That will be an unbelievably painful procedure. After having gone through all of this, you'll probably feel depressed. But don't expect to get any sympathy from your doctor. Expect to get some Prozac or even Ritalin, because the studies show it works. And because your doctor is too embarrassed and ashamed to talk to you about it, because all the treatments and drugs he's given you so far have been utterly useless. He'd rather you just shut up and stop complaining than to have to deal with his failure of not being able to cure your cancer. The next thing that happens is that you get put on a morphine drip for the unbelievable cancer pain that you are having. You're sent home with powerful painkillers. You'd think that would be the end of it, right? That you just slip away painlessly. But now, because of the pain medications, you're extremely nauseated and you're always vomiting. Not only that, but the medications has completely stopped your bowels and you can't have a bowel movement. This situation can go right into a medical emergency, because now there is a risk of your bowel perforating or bursting because it is so full and can't empty itself. Now you're in the hospital again, screaming in agony because your belly hurts so bad and you're still vomiting from the pain medication. The in-vogue cancer treatment is the bone marrow transplant. All this means is that the doctors are going to give you an even greater amount of chemotherapy that is so toxic it's going to completely wipe out your bone marrow. So this is why you need to have someone else's bone marrow transplanted into you, because you don't have any left. Only it's not that simple. After the transplant, there will be a long period of time where you'll be isolated, where you'll be in isolation in the hospital waiting to see if the new marrow takes. Since it's not your bone marrow, now we have to worry about whether your body's going to reject it, or in this case, whether the bone marrow is going to reject you. Because you're in such a weakened state that all that poisoning and not having any immune system left, that bone marrow could very well kill you. Or it may decide not to grow. This period of time is torturous because in this state, the slightest germ that in someone else would give them a cold could give you a massive infection that spreads into your bloodstream and kills you. After you die, your relatives will scramble to sell your mortgage, everything because of the massive hospital bills. Remember, your insurance company dropped you. They will be overcharged for your unbelievably long and slow torture by injection because according to the Bureau of Vital Statistics, 99% of all hospital bills contain overcharges. There is no way to cure cancer with poisons. There is nothing pretty or glamorous about having chemotherapy done. There is absolutely nothing heroic about having yourself tortured and poisoned and allowing yourself to be a victim of the medical pharmaceutical industry. You've seen what chemotherapy does to people. You know it makes you lose weight, lose hair, and puke your guts out. So why would you choose that? If you want to be a real hero, why not consider healing yourself in a natural way with Dr. Schultz's Incurables program? Take some responsibility, be patient, and be willing to undo all those bad things you did to your body for all those years. This is God's way, nature's way, and in a kind and merciful way, chemotherapy makes the Incurable program look like a cakewalk. So you know that there is a choice between chemotherapy and natural healing. So it's up to you. I'm not attached to what you want to choose or anything, but use your head, use your noggin, and if you're in it, you can always stop it and go to natural healers. Love life, and life will love you back. See you in the next video.